My name is William Remling, BSN RN, currently pursuing my Master's of Science in Nursing, Family Nurse Practitioner at Texas A&M Corpus Christi. This is my integrative systematic review of the literature to teach back versus standard discharge instructions. The emergency department discharge has potential for miscommunication of health information. Has been recognized as a high-risk transition area of care. As an ER nurse for the last 7 years, I've given numerous discharge instructions to patients. Multiple times a day, discharge instructions are written or verbal information given upon the patient's discharge from the emergency room or the hospital, clinic, wherever they were receiving treatment. The instructions summarize the patient's visit and what their continued plan of care will be upon leaving the facility. On pretty much every discharge instructions that I give, I will ask the patient at the conclusion of the instructions if they understand, if they have any questions. 99% of the time, the patients will tell me that they completely understand the instructions. The problem is, a couple days later, the patients are back with worsening symptoms. Infections have gotten worse, cough has gotten worse, they don't understand why. We go back over the discharge instructions, find out that they were either taking their medicines incorrectly, stopped medications that they were supposed to continue, never filled medications, or didn't follow up with a surgeon or a primary care provider because they truly didn't understand the instructions. It would be easy to just assume that the solution is as simple as making the patients listen, but it's not. A recent report by the Institute of Medicine estimates that limited health literacy affects as many as 90 million Americans. Multiple other studies performed to evaluate comprehension of discharge instructions reported that a few days after discharge, up to 78% of patients do not have a full understanding of their instructions. Proficient health literacy is needed for a patient to interpret and have conversations about the health information. But what is health literacy? First, let's take a quick look at literacy. Literacy is the ability to read, write, and use language skills. Health literacy is an individual's ability to comprehend and use health information to make an informed decision about their care. What are the consequences of not solving this problem? Well, a major element of successful healthcare is patient comprehension. The inability of patients to comprehend their health information has been linked to ineffective care, negative health outcomes, poor compliance, and worst of all, overall health. It is estimated that the toll of limited health literacy on the U.S. economy yearly is between $100 to $240 billion. It also has been shown to increase the cost of an admission by almost $1,000 per patient. So my PICO research question was, in patients discharged from the hospital or emergency department, would providing discharge teaching utilizing the teach-back method, compared to standard discharge instructions, improve patient health literacy comprehension of the discharge information? So my purpose of the systematic review of the literature is to determine whether the teach-back method improves patient health literacy of hospital and emergency department discharge instructions compared to just standard discharge instructions. So what is the teach-back method? The teach-back method, also called the show-me method, is a communication method used to teach health information either during the visit or at discharge. The information is given to the patient by the provider. The patient confirms they understand the information by repeating it back. The methods I used for my systematic review of the literature, the search terms were teach-back, emergency department, discharge instructions, and health literacy. The databases I searched were Senhall, PubMed, Medline, and the Cochrane database. The inclusion criteria that I utilized, the articles had to be primary research involving hospital and or emergency department discharge instructions, research involving limited health literacy and discharge instructions, research involving the teach-back method, current research, preferably within the last 5 years, and studies that included adult patients over the age of 18. Studies were excluded if they did not include information about the teach-back method, they did not include information about hospital or emergency department discharge, they were not full-text articles, the articles were not in English, and obviously duplicate articles were also removed. The articles were appraised using the quality appraisal review checklist and assessment criteria. The data to be extracted was the reference, the author, year, journal citation, the study design and purpose, the study setting and participants, the study protocol, duration of the study, outcome measures, data analysis, the results, and the conclusions. So the search strategy aimed to find studies using the discussed inclusion-exclusion criteria. The electronic databases searched produced 464 articles. After reviewing the articles using the inclusion-exclusion criteria, 456 of the articles were excluded for the following reasons. Not full-text articles, I excluded 204. Not academic journals, I excluded 28. I excluded 126 that included pediatric patients. I excluded 83 that were not performed in the emergency department. Excluded an additional 12 that did not contain information about the teach-back method, and 3 additional were excluded for not being in English. I had 8 remaining articles that met the inclusion criteria. 3 more were excluded because they were not primary research studies. That left me 5 that were included in the systematic review of the literature. After performing the review, 80% of the articles reviewed indicated that teaching interventions that utilize simplified text, multimedia tools, and the teach-back method were more effective than standard discharge instructions. Though the teach-back method appears to be more effective than standard discharge instructions, further research examining the long-term benefits of the teach-back technique is still recommended by 75% of the studies. There were some limitations. There's only been a limited number of studies performed on the topic. This suggests a knowledge gap and a need for further research studies to be conducted to continue to explore effective teaching methods. The results of the systematic review of the literature revealed the correlation between health literacy and health outcomes. Patient comprehension of discharge instructions must be a priority for healthcare providers, as it has shown to lead to improved health outcomes. The purpose of my systematic review of the literature was to determine whether the teach-back method improves patient health literacy of hospital and emergency department discharge instructions compared to those performed with standard discharge instructions. 80% of the studies included in the review show that the teach-back method can improve comprehension of discharge and home care instructions compared to standard discharge instructions. Therefore, the relationship between literacy and health is complex, but healthcare providers need to utilize effective health communication skills. The teach-back method has shown in limited studies to be an effective communication tool to convey health information. Nonetheless, many opportunities remain for further research. In my personal opinion, after doing the systematic review, I do plan to implement the teach-back method in my discharge instructions in my current practice and in my future practice. Thank you.